So today we are going to be doing a trauma assessment. So PSI is my scene safe. So my scene is safe. All right, so based on dispatch information, my mechanism of injury is ejection from motor vehicle. Now, is this my only patient? This is my only patient currently at the moment. Okay, so I'm going to go ahead and request for ALS intercept, and then based on mechanism, we're going to take a full C-spine precautions with this patient. So from general impression, I have a 26-year-old male who's been ejected from a motor vehicle. I'm going to determine level of consciousness really quickly. Sir, are you okay? So from the patient responds to painful stimuli. From there, I'm going to go ahead and assess ABCs. I'm going to assess to check their airways. There's nothing in their airway, and the patient seems to be breathing. So now I'm going to be moving on to circulation. I will go ahead and then assess for any major bleeding. And I'm going to also assess the skin. The skin is pale, cool. And then based on skin presentation, I'm going to also treat for shock right now. I'm going to make this a priority transfer prior to patient, and we're going to transport. If he is conscious and talk to me, at this point I will obtain a sample history because he will not bypass that. Secondary assessment, I'm going to do a head-to-toe palpate. I'm going to go ahead and do it on the head, the face, the ears to see if there's any bleeding. And from there, I'm also going to check the pupils to see if I can notice anything as well. And then from there, I'm going to go down and check the chest and also palpate the abdomen along with the pelvis. And the pelvis is stable. I'm then going to palpate the legs. And I'm also going to palpate check the distals. And I'm also going to check for circulation up here. So I got to head to toe done. Now we'll be transporting. So I'm going to go ahead and manage my secondary injuries. The things I'm concerned about are the decrease in breath sounds. I'm managing that right now currently with oxygen. And then we are going to go ahead and continue reassessing. We're going to continue reassessing the breast tones, the legs, check for distal pulses. And then from there, we will then continue to reassess the vital signs every 5 minutes because he is a critical patient. And that's it.